What if I told you the numbness, tingling, or dead feeling in your feet isn't just a normal part of aging, but a warning sign that your body is slowly losing its ability to keep you standing? That may sound uncomfortable to hear, but it's something I see every single week in my patients over 60. It doesn't start with a fall, it starts with something much quieter. You begin to feel unsure when you stand up. You glance down at your feet more often. You walk a little slower, but it's not because you want to, but because something doesn't feel right. And over time, without realizing it, your world starts to shrink. Many people are told it's neuropathy. Learn to live with it. But as a surgeon who has worked with older adults for decades, I can tell you there's a critical piece missing from that advice, because your nerves are not simply gone. They're disconnected, understimulated, waiting for the right signal. And in today's video, I'm going to show you exactly how to send that signal using 5 simple chair exercises that can begin restoring strength, balance, and confidence faster than you think. Before we dive in, 1. The seated march that turns your nerves back on. There's a moment many of my older patients describe, not when they're walking, but right before they even take the first step. They stand up and hesitate, not because of pain, but because their legs don't feel ready. Almost like the signal from the brain hasn't arrived yet. If that sounds familiar, this first movement may be the most important one you do all day. Sit toward the front edge of a sturdy chair, not leaning back. Your feet should be flat on the floor, about hip width apart. Before you even start moving, take a second and notice your posture. Sit tall, not stiff, just upright enough that your chest is open and your head is stacked over your shoulders. This position matters more than people think because it allows your nervous system to stay fully engaged. Now begin slowly lifting one knee up toward your chest, just a few inches. You don't need to raise it high. Lower it down with control, then lift the other knee. Continue alternating side to side like a gentle march. Here's where most people get it wrong. They rush. I want you to slow it down enough that you can actually feel each movement. As your right knee lifts, let your left arm move forward naturally, just like you would when walking. Then switch. This cross-body pattern is not random. It forces both sides of your brain to communicate, which is exactly what neuropathy disrupts over time. Breathe normally. You should feel your heart rate rise slightly, but still be able to speak comfortably. That's your target zone. Start with just 30 seconds if that's all you can manage. If you feel steady and comfortable, build up to 60 seconds, then eventually 2 minutes. This is not about endurance. It's about sending consistent signals from your legs back up to your brain. What's happening beneath the surface is powerful. Every time you lift your leg, your muscles contract and act like a pump, pushing blood back up through your veins. When the leg lowers, fresh oxygen-rich blood flows back down into the feet. For nerves that have been starved of circulation, this is like turning the lights back on. But there's another layer that's even more important. If you've been dealing with numbness or tingling for a while, your brain has slowly started to ignore signals coming from your feet. This exercise interrupts that pattern. It tells your brain, pay attention, your legs are moving again. That's how reconnection begins. If you feel unsteady, keep your hands lightly on the sides of the chair. If one leg feels weaker or slower, that's valuable information, not a problem. Move at the pace your body allows today, not what it could do 10 years ago. And one more thing most people overlook, timing. The best moments to do this are during real life, not separate workout time. While watching the morning news, during a commercial break, or even while waiting for your coffee to finish brewing. These small windows add up, and consistency is what rewires the system. Ignore this stage, and the heaviness often turns into hesitation, and hesitation into instability. But catch it early, and you can restore that sense of control faster than you think. Now, once the blood is moving and your brain is starting to reconnect, the next step is waking up the exact muscles that keep you from tripping. And most people don't even realize they've stopped using them. Now let's move on to point number 2. 2. The heel-to-toe rock, the missing link between your feet and your balance. Let me ask you something most people don't realize until it's too late. When you walk, do your feet actually lift, or do they quietly slide across the floor? That small difference is often the reason why so many adults over 60 begin to lose confidence in their walking. It's not just weakness, it's that the muscles responsible for lifting your feet and stabilizing your ankles have slowly gone inactive. And when that happens, your brain stops getting clear signals from the ground beneath you. This is where the heel-to-toe rock becomes essential. Sit in a firm chair with both feet flat on the floor, about hip width apart. Make sure your shoes are off if possible, or at least wear something flexible so your feet can move naturally. Sit upright, not stiff, but supported, and place your hands gently on your thighs. Now begin by lifting both of your heels off the ground while keeping your toes planted. You should feel your calf muscles tighten. Hold that position for just a second, long enough to notice the contraction, then slowly lower your heels back down. Without pausing too long, shift your movement in the opposite direction. This time, keep your heels on the floor and lift your toes and the front of your feet upward. You'll feel the muscles along the front of your lower legs, the shins, activate. Hold briefly, then lower your toes back down. Continue this gentle rocking motion. Heels up, down, toes up, down. What matters here is not how many you do, but how well you feel each phase. Most people rush through this and miss the entire benefit. I want you to slow it down enough that you can clearly sense the pressure shifting from the front of your foot to the back and back again. Start with 10 repetitions. If that feels manageable, gradually work up to 15 or even 20, but always prioritize control over quantity. Now, here's why this simple movement is so powerful, especially if you're dealing with neuropathy. When you lift your heels, you activate your calf muscles, which function like a second heart. They pump blood upward, improving circulation not just in your legs, but all the way down into the small vessels that feed your nerves. When you lift your toes, you engage the muscles that prevent you from tripping. These are often the first muscles to weaken with age, especially if you've spent years walking on flat, predictable surfaces or wearing stiff shoes. But beyond strength, this movement retrains something even more important: your brain's awareness of your feet. Every controlled rock sends a signal upward. This is where I am. This is how I'm moving. Over time, that signal becomes clearer, faster, and more reliable. That's how balance improves, not by chance, but by rebuilding communication. If you've ever felt unsure stepping off a curb or hesitant walking on uneven ground, this is the exercise that starts to change that. And yet, even with better circulation and stronger muscles, there's still one problem many people don't address. The nerve itself can still feel stuck, like it's not gliding smoothly through the body. And that's exactly what we're going to fix next. 3. The seated nerve glide, the movement that frees the stuck signal in your legs. Here's something most people never get told. Sometimes the problem in your legs isn't just weakness or poor circulation. It's that your nerve is literally not moving the way it should. If you've ever felt a pulling sensation down the back of your leg, or a strange mix of tightness, tingling, and discomfort that seems to travel, that's often a sign the nerve is irritated or stuck somewhere along its path. And when that happens, your brain doesn't receive clear signals from your feet. Everything becomes delayed, distorted, or muted. This is where the seated nerve glide comes in. And when done correctly, it can feel like you're giving your nervous system room to breathe again. Start by sitting in a firm chair with your back upright. Scoot slightly toward the front so your feet are planted and your posture is active, not relaxed. Now, lift one leg slightly off the ground and place both hands gently behind your thigh, not your knee, but the back of your thigh for better support. From here, slowly begin to straighten your knee. As you extend your leg, pay close attention. You may feel a gentle stretch behind your thigh or calf. That's exactly what we want. But here's the key. You stop before pain. This is not a stretching contest. Nerves are sensitive structures. If you push too far, they tighten up even more. So, only go to the point where you feel a mild tension, what I often describe to my patients as a comfortable awareness. Once you reach that point, pause briefly, then slowly bend your knee back to the starting position. Repeat this movement 5 to 10 times on one leg, then switch to the other. Now, if that feels comfortable after a few sessions, you can add a small progression. At the top of the movement, when your leg is extended, gently pull your toes back toward you, then point them away. Just a small motion, controlled and smooth. This added movement increases the glide of the nerve through the surrounding tissues, almost like flossing between tight spaces. What's happening inside your body is subtle but powerful. You're reducing mechanical tension on the nerve, improving its ability to slide freely, and restoring normal communication between your lower back, your leg, and your foot. This is especially helpful for those who spend long hours sitting, whether it's watching TV, driving, or reading. Over time, nerves can become compressed or restricted simply from lack of movement. And here's something important to understand. This exercise is not about immediate relief. It's about gradually improving how your nerve behaves over time. If you feel a slight reduction in tightness or a smoother sensation in your leg after a few days, that's a sign you're on the right track. But if you feel sharp pain, stop and reassess. This movement should feel controlled and safe at all times. Now, while freeing the nerve is essential, it's only one piece of the puzzle. Because even if the signal is clear, your feet still need to respond. And what we're about to do next is how you wake up the smallest, most overlooked muscles that make that possible. Now, let's keep going with point number 4. The towel scrunch, the hidden foot exercise that wakes up silent nerves. Most people never realize this, but by the time neuropathy shows up in your feet, the smallest muscles down there have often already started to shut down. Not completely, just quietly. They stop responding the way they used to. Your toes don't grip, your foot feels flat, almost lifeless. And over time, that lack of control affects how you stand, how you walk, and how safe you feel doing either one. This is where a very simple but surprisingly powerful movement comes in. Sit comfortably in your chair with your feet flat on the floor. Place a small towel on the ground in front of you. It doesn't have to be anything special. Just a hand towel or even a dish towel will work. Now, place one foot on top of the edge. of that towel. Here's the movement. Using only your toes, begin to slowly bunch the towel toward you. Spread your toes, then curl them down to grab the fabric, then pull it closer. Release and repeat. At first, this may feel awkward, almost like your toes don't quite understand what you're asking them to do. That's not a problem. In fact, that's the point. What you're doing here is reactivating nerve pathways that haven't been used in a long time. Start with 8 to 10 repetitions on one foot, then switch to the other. Take your time with each movement. The slower you go, the more your brain has to pay attention, and that's exactly what helps rebuild the connection. If you don't have a towel, you can use small household objects like a sock, a washcloth, or even try picking up something light like a pen or a few coins. Many of my patients actually enjoy turning this into a small daily challenge. Now, here's why this matters more than it seems. The muscles in your feet are responsible for stabilizing you every time you stand or take a step. When those muscles weaken or stop responding, your body loses one of its most important balance systems. That's when people begin to feel unsure on their feet, even if their legs are technically strong. By doing this exercise regularly, you're not just strengthening muscles, you're teaching your nervous system how to communicate again. You're restoring control in an area that most people completely overlook. One important note: if you have reduced sensation in your feet, always check the skin afterward. Look for redness, irritation, or any small cuts, especially if you're doing this barefoot. With consistent practice, you may start to notice something subtle but powerful. Your feet feel more alive, more responsive, more connected to the ground beneath you. But even if your muscles are waking up and your nerves are starting to respond, there's still one final piece that determines whether you truly feel stable when you stand. And it has everything to do with how your brain senses the ground itself. 5. The seated ground press, the missing link between your brain and your feet. Here's something I often ask my patients, and it usually stops them in their tracks. When was the last time you truly felt the ground under your feet? Not just standing, not just walking, but actually feeling it clearly, confidently, without hesitation. Because for many adults over 60 dealing with neuropathy, that connection slowly fades. The feet are still there, but the brain isn't receiving clear information anymore. And when that signal becomes blurry, balance becomes uncertain, and every step starts to feel like a guess. This final exercise may look simple, but it addresses that exact problem at its core. Sit upright in your chair, close to the edge, with both feet flat on the floor. Make sure your shoes are off if it's safe to do so. Barefoot or thin socks will allow you to feel the surface better, which is exactly what we want here. Now pause for a moment. Before you move, bring your attention to your feet. Notice where they touch the ground, your heels, the balls of your feet, your toes. Most people haven't paid attention to this in years. Now gently press both feet down into the floor. Not hard, not forceful, just a firm, intentional press, as if you're trying to leave a footprint in soft sand. Hold that pressure for about 5 to 10 seconds, then relax. Repeat this process slowly, 8 to 10 times. As you do it, don't just go through the motion. Stay mentally engaged. Feel how the pressure shifts across your foot. Notice if one side feels weaker or less responsive than the other. This awareness is part of the training. What you're doing here is something incredibly important. You're retraining your brain to recognize input from your feet again. This is called proprioception, your body's ability to sense where it is in space. And when neuropathy disrupts that system, your brain starts relying on guesswork instead of clear signals. This exercise removes that guesswork. It tells your brain, this is the ground, this is where I am, this is stable. Over time, that repeated message strengthens the connection between your feet and your nervous system, and that's what restores confidence. Not just strength, but trust in your own body. This is especially useful before standing up. Try doing a few rounds of this ground press, then slowly rise from your chair. Many people notice they feel more steady, more aware, and less hesitant in that transition. A gentle reminder, if you have significant loss of sensation, always check your feet afterward for any signs of irritation, especially if you're practicing without shoes. What I want you to understand is this: balance doesn't start in your legs. It starts in your brain's ability to feel your feet. And now, you've just trained that connection directly. But here's the real question. What happens when you combine all 5 of these movements into one simple daily routine? And why do some people see real improvement while others don't? That's exactly what we're about to bring together next. Your future starts with what you do today, reclaiming strength, stability, and confidence after 60. Let me leave you with something I tell my patients all the time. What you're feeling in your feet right now is not just about today. It's a preview of where your body is heading. Because neuropathy, balance loss, and that quiet disconnect from your lower body don't suddenly appear overnight. They build slowly, often unnoticed, until one day you find yourself hesitating before standing, reaching for support more often, or feeling unsure walking across a room you've walked through for years. That's the reality many older adults face, not because they did something wrong, but because the body changes with time. Circulation slows, nerve signals weaken, Muscles that once worked automatically begin to fade into the background. And here's the part most people don't talk about. These changes don't pause while you sleep. At night, when your body is still for hours, blood flow decreases even further. Nerves receive less stimulation. Muscles remain inactive. And if your system is already underperforming, that long period of inactivity can make morning stiffness, numbness, and instability even worse. That's why so many people feel their symptoms most strongly when they first get out of bed. Now, imagine what happens over the next 1 to 5 years if nothing changes. That slight numbness may turn into a constant dull sensation. That small loss of balance may become a real risk of falling. That hesitation you feel today may turn into avoidance, avoiding stairs, avoiding walks, even avoiding leaving the house. And with that, something even more important begins to fade: your independence. But here's the truth I want you to hold on to. This process is not fixed. The body, even in your 60s, 70s, and beyond, still responds to the right kind of input. It still adapts. It still rebuilds if you give it a reason to. And that's exactly what you've done here today. Each of these 5 simple chair exercises is not just a movement. It's a signal to your brain to reconnect, a signal to your muscles to engage, a signal to your nervous system that your feet still matter. You don't need to do everything perfectly. You don't need to do everything at once. You just need to begin and stay consistent, because the difference between decline and stability over the next few years often comes down to small daily actions like these. So as you move forward, don't think of this as just exercise. Think of it as maintenance for your independence, protection for your future, a way to stay connected to your body and to the life you want to keep living. And now that you understand how these movements work individually, let me show you how to combine them into one simple daily routine that takes less than 15 minutes but can completely change how your body feels and functions. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. Thank you for watching, and here's to living life on your own terms.